Hello friends, I am Dr. M. Anbarasi, Professor and Head Department of Physiology from Chettinad Hospital and Research Institute. I am very happy to be a part of this module on sleep. This session, we are going to see about the stages of sleep, sleep health and little about sleep deprivation. Before going into the topic per se, let me tell you a short storyline. Imagine you are an intern and you have seen almost 32 hours of duty continuously the previous day, and you are just in the ICU with all the buzzing sounds and the monitors and the lights everywhere. It's annoying, some sort of annoying, and you are just on top of it, you are just resting over the nurse's desk, and what happens is suddenly your cell phone beeps and you are waking up, and without knowing what to do, you are just baffled and you enter into a patient's room and you forget for what you came. Okay, does this situation sounds familiar? Whenever any healthcare worker, when they are in a night shift or night duties, they go like this. Not only the healthcare workers, even in other sectors also, whenever they are in a shift change or shift duties, this happens, especially in the night duties. Okay, so what is this actually? Is that a problem? It's just because of the lack of sleep. Okay, so as we all think, sleep is not just a time off. It's not just a relaxation or resting period. Actually, the sleep is a very active and complicated physiological process. Okay, that every one of us are encountering every day. Every 90 minutes, our brain is actually undergoing cyclical changes in the brain activity, and this occurs repetitively throughout the duration of the sleep, as if it is something very carefully choreographed dance between restoration and renewal. Okay, so I am going to take you all through the stages of sleep in detail in this session. Also, we will be seeing about the sleep health and the effects of sleep deprivation in short. Detailed aspects of the sleep deprivation and the disease or disruption will be taken in the next few weeks of sessions. Before going into the stages in depth, we will see how it started first. These are the two important researchers who did a lot of work on sleep. One, Giuseppe Maurizio. In the late 1940s and in the early 1950s, what he discovered was a remarkable thing. He discovered two aspects. Number one, he found out that transaction of the ascending sensory pathways did not disrupt sleep. This actually disproved the belief that sleep was due to some sort of lack of sensory input. So that was abolished, that view was abolished. The next feature what he found was transecting the brainstem, including its reticular formation through the pons, actually reduced sleep to a greater extent. So this is one of the key findings. So that means there is some area in the brain that is responsible for the sleep induction as well as sleep inactivation. Okay. Next, this person, Nathaniel Kleitman, he is considered to be the father of the sleep research. What he found out was sleep is not just a single process that happens throughout the night when we hit the bed and when we wake up. That is not the single process. It is actually two distinct phases that alternated in a cyclical pattern. These two important features, that is, one is the existence of the sleep areas, the other one is the different phases of the sleep. These two actually, in that sleep is passive process, it is a very active and highly organized brain state with different phases in it. Let us move into the stages of sleep. Now, what are the parameters that actually mattered while staging the sleep? Brain was active during sleep. That was evident with the help of EEG, right? Then there were some movements in the eyes. So that was evident in EOG, electrooculogram. And sleep was also associated with certain skeletal movements. So those details was given by EMG. So these three parameters, EEG, EOG and EMG, were used to stage sleep basically. Accordingly, there were two stages, rapid eye movement stage, that is called as REM sleep, and non-rapid eye movement sleep, that is NREM sleep. Always remember, the key finding or the key difference between these two stages is this eye movement. Okay. Once again, the non-rapid eye movement stage is also classified into different stages like stage 1, 2, 3 and 4. Okay. Now, there are two scoring systems or manuals for the staging of the sleep. One was the age-old manual given by Redschaffen and Kales, popularly called as R&K manual. This manual was used for almost 40 years, okay, until another system of scoring came into practice. The American Academy of Sleep Medicine AASM manual was first given in the year 2007 and it has been constantly updated. Latest update was done in 2023. Now, this AASM manual is in practice in the clinical setup. Let us compare between the AASM manual and R&K manual. First, we will see about the R&K manual, which is the oldest staging. Okay, this R&K manual is actually based on the visual scoring system. That means the expert will see and they will stage. Okay, so this is subjected to observer bias. Right, so it's a subjective assessment or staging of the sleep. According to the R&K manual, there are 7 stages. The first stage is stage W, that means it's a wake stage. Then comes the NREM sleep, which is again divided into 4 phases, stage 1, 2, 3 and 4. Then 6th is the stage REM, which is following the NREM sleep, that is actually the REM sleep. The 7th is actually movements, considering the movements. This is 7, but we graphically also we will see only the 6 stages, right. The disadvantage of this R&K manual is that this is a very subjective method of staging the sleep. Also, the normative guidelines for staging the sleep is available only for the young individuals. It does not consider the elderly individuals as well as the people with some disrupted sleep. So, the data is not available. So, nowadays this AASM manual is what is used. AASM manual on the other hand, it records the electrophysiological parameters from 3 pairs of electrodes, frontal, occipital and central electrodes. Okay. The greatest difference between the AASM and the R&K manual is the nomenclature. Here wake state is represented by the same stage W. Okay. In the NREM sleep, stage 1 of R&K is given the name N1, stage 2 N2, stage 3 and 4 put together is called as N3. So, this is actually the deep sleep, N3 is the deep sleep and N2 and N1 is the light sleep. Okay. The deep sleep is also called as low wave sleep, we will see that later. And REM sleep is called stage R. Okay. So, this is the biggest difference in the nomenclature. This AASM manual also gives information on the sleep-wake transition periods, the spindles, the K complexes, all these differences in the EEG pattern, slow wave sleep cycles, okay, ocular movements and also the skeletal muscle movements, cardiorespiratory events, temperature changes, all these parameters are taken into consideration and these are all recorded in the polysomnography and the stages are being explicitly given. Okay. So, this is about the stages of sleep based on the scoring system by the 2 different methods AASM and R&K. Now, this is a picture of graphical representation of the sleep stages over the entire sleep duration and this is called as hypnogram. Okay. So, what is hypnogram? It is a graphical representation of the stages of sleep over a period of time, usually recorded in a 30-second epoch in polysomnography. Right. The x-axis represents the hours of sleep, 0 representing the onset and 8 representing the maximum duration of the sleep. Y-axis represents the stages of sleep, where W represents the wake stage, N3 is the deep stage of NREM, in between you have got REM. Now, how does a person goes to sleep? From wake stage, he goes to the N1 stage, stays there for some time, say this is the latency, then next stage is reached, then there they stay for some time, that is the latency or transition stage, transition to the next stage, then comes to the N3, stays there for a longer time, and then goes back to N2. From N2 he goes back to the REM sleep. Okay, this jagged lines represents the REM sleep stage. Okay, so this constitutes one sleep cycle. Say from wake stage going to the N3 stage and going to the next, say ending in the REM sleep. Okay, from REM to the next cycle. This is actually one cycle, one sleep cycle, which is for about 90 minutes in adult. Okay, so this is one sleep cycle. Okay, now this is the onset of sleep we told. Okay, and this is called as sleep latency. This period from wakefulness till he reaches the N1 stage, that is called as the sleep latency. Okay, these are the deep sleep, these duration. If you can see, the duration of the deep sleep decreases as the sleep prolongs over the period of night. It was this big, now it is decreased, and here it is much decreased. Okay, so this is the duration of the deep sleep in the N3 stage, NREM sleep. On the other hand, the REM, you can see the REM stage duration gradually increases as the night prolongs, and you can see the REM sleep is greater during the morning when the night meets the morning. Okay, so gradually the length of the REM sleep increases as the night prolongs, whereas the stage of the deep sleep decreases as the night prolongs. So in the early hours of the sleep you have many deep sleep durations, whereas in the later hours of the sleep towards the morning you have many REM episodes. Okay, right. Now this small projections from the REM sleep, here again there is some small REM sleep, these are called as brief awakenings. Sometimes we get up from the bed, we wake up, and then once again we change the position and again we will go to sleep, right? So these are the brief awakenings that happens normally. So in a healthy adult, there are at least 4 to 5 sleep cycles over a period of 6 to 7 hours of sleep. Okay, so that is what is given here. Every 90 minutes the cycle repeats. There are 4 to 5 cycles in a normal 6 to 7 hours sleep. NREM stages are 1, 2 and 3. N1, N2 and N3 we can call it that way. REM sleep is gradually increasing in duration. Deep stage is gradually decreasing. The REM sleep changes with the age group. In adults 25% of the sleep time is REM sleep, whereas in premature infants it is 80%. In full term infants it is again 50% of the sleep is in REM sleep. Children sleep more in the REM phase. This is a hypnogram comparing the young adult and the elderly person's sleep. Okay, you can see the young adult, typically there are 1, 2, 3, 4, 5. 5 sleep cycles were clear and it is regularly occurring. Towards the end of the sleep, that is just before the morning, in the morning, early morning hours, the cycle length, this is 90 minutes, then again this is increasing, say maybe 100 or 110 minutes, then this is again increasing, this is increasing, the cycle length gradually increases. This is the typical normal hypnogram. The same thing in elderly. The stage transition, there is the latency to fall asleep is also increased. The stage transition from one stage to another stage is also increased. See, this is the small gap, whereas this is a big gap. Okay, so the latency to the next sleep, that is a sleep transition, that is getting affected. Look at the duration of the sleep in the N3 stage, that is the deep sleep stage. Elderly people don't have the deep sleep at all. they don't spend their night in the N3 stage at all. It is only 1. Okay, and you can see frequent awakenings. These are all awakenings. These are all small awakenings. Most of the sleep time is in the light sleep stage, that is N1 and N2. Look at the REM sleep. Sometimes it is preserved, but sometimes there is fragmentation. The REM is actually fragmented. See this here, you can see the fragmented REM sleep. Okay, so elderly people, the onset itself is delayed. There will be frequent awakening. There will be more transition from each stage. The sleep, deep sleep is much reduced in elderly people. REM sleep is also reduced and more frequently it is fragmented. In elderly people, only the light sleep is more predominant, and overall the efficiency is lower. When compared to the young adult, the onset of sleep is brief. Deep sleep is there definitely. Most of the time they spend in deep sleep, especially in the early hours. REM sleep predominates in the later hours, repeats every 90 minutes, and the sleep architecture is regular, consolidated and restorative. Most of the time it is a deep sleep. Okay, so this is the difference between the hypnogram of young and elderly people. Coming to the duration of the sleep, very obvious, it inversely varies with age. People who have a newborn babies and infants at home, you would have observed that babies always sleep. They sleep at least 16 to 18 hours. Every sleep duration maximum 2.5 to 4 hours they can sleep. Their sleep has typically 3 different types. One is quiet sleep, active sleep and indeterminate sleep. Okay, and adults, they start their sleep in N1 stage, that is NREM stage, whereas children, the onset occurs through the REM sleep. That is the biggest difference. Okay, and there occurs only 1 or 2 cycles, because the sleep episode is only short, that is 4 hours or something like that. When they are born new, they don't have any circadian rhythm developed. Only by 2 to 3 months their circadian rhythm develops, and by 2 months they slowly progress into the night sleep. Then only they sleep in the night. The night sleep duration is somewhat prolonged. Okay, by 3 months the melatonin secretion and the cortisol secretion, they all come into some decent levels, and they are initiating the circadian rhythm, and this is what is actually the period where the sleep will start with an NREM. Before that it started with the REM sleep. Okay, so total NREM and REM sleep duration is only 50 minutes, whereas in adults it is 90 minutes. So one cycle is constituting only 50 minutes. At 6 months the longest sleep starts, which is about 6 hours, and at 1 year the sleep will be for 14 to 15 hours, and usually they start sleeping by early evening and they continue their sleep throughout the night. Morning sleep duration will be decreased by 1 year onwards. Toddlers 2 to 5 years, they sleep for 11 hours, and children by 6 years, they develop circadian preferences. Some kids, they tend to be night owls, and some kids, they tend to be early risers, and they spend most of the time in the deep sleep, that is N3 stage. Adolescent is a period of greater fluctuation in all the bodily parameters. Here again in sleep they have greater fluctuations. 9 to 10 hours they tend to sleep, and they spend more time in N2 stage, and the slow wave sleep and the sleep latency declines in adolescent period. This is all because of the puberty changes and the hormonal burst. Their daytime sleepiness is increased in adolescence. In adults, that sleep duration is about 7 to 9 hours. It is ideal. They tend to have earlier sleep time. They wake up earlier also. They have reduced sleep consolidation in adulthood. Old age, we just saw, they go to bed early, they wake up also earlier than the adults. Not to forget to tell about the gender differences in the sleep. Men tend to have their most of the time of sleep in N1 and N2 stage, that is the light stage, whereas the women, they spend more of the sleep time in N3 stage. Men have more occurrence of this daytime somnolence because they don't have proper N3 or deep sleep stage, they tend to have more daytime somnolence. Women, it's not like daytime somnolence is not there. It is there because they have the hormonal fluctuations, and women tend to have this excessive daytime somnolence during pregnancy and postpartum period. Coming to the normal EEG waves, this might be a repetition for you, but it is worth repeating according to me. So these are the wave patterns that are seen in the from the brain activity. When a person is awake with the active mental activity, thinking about something, he is awake and alert, beta rhythm predominates. So what is this beta rhythm? It is high frequency, low amplitude wave pattern, and the frequency is not regular. That is what is more important. It is not regular, and it is not representing any regular brain activity. Okay, so such an activity is called as desynchronized rhythm. Desynchronized rhythm means it is not corresponding with the brain activity. The wave pattern is of high frequency and low amplitude. Okay, and it is not regular also. Then when the person goes to the awake and resting stage, just he has closed the eyes and he has not fallen asleep, but he has closed the eyes. Okay, or sometimes even in the resting stage. That time the alpha rhythm predominate. You can see the difference between the beta and the alpha. The amplitude, the height of the wave is somewhat bigger and the frequency is decreased. 8 to 13 hertz is the frequency. Okay, then when the person goes to the N1 or N2, when he is sleeping, that is a light sleep stage, theta rhythm predominates. 4 to 7 hertz will be there, and you can see the theta waves is greater amplitude and lesser frequency. Then when the person goes to the deep sleep stage, delta rhythm predominates. You can see the bigger waves and lesser frequency. Only less than 3 hertz frequency is seen in the delta. Okay, so these are the normal EEG waves. We will see next the alpha, theta and delta waves. You can see you can predict also the regular occurrence of the next rhythm and the wave pattern. The amplitude is greater and the frequency is lesser, and they are regular. They are synchronized with the brain. That is why they are called as synchronized wave pattern of EEG. Coming to the non-rapid eye movement sleep in detail. This is also called a slow wave sleep or deep sleep. Okay, so we saw this stage has got this sleep has got 3 stages: N1, N2 and N3. Okay, so N3 is including stage 3 and stage 4. Yes. In N1, which constitutes about just 5% of the total sleep duration, the subject will become drowsy. Okay, the beta wave which was seen in the alert stage now will change to alpha rhythm. Okay, it is a light sleep stage which has got low amplitude, high frequency pattern, alpha rhythm, and also theta rhythm will also be seen. There will be slow rolling eye movement seen in this stage, in the light sleep stage. Coming to the N2 stage or stage 2, which is actually forming 50% of the total sleep duration. Here the amplitude of the EEG wave slightly increases. There occurs 2 important aspects. One is the sleep spindles and the K complexes. Sleep spindles are nothing but looking like a burst of alpha waves which has got high frequency, low amplitude waves. Less than 50 microvolts will be the amplitude. Usually last for 2 seconds, and the amplitude is typically having a characteristic waxing waning pattern. We will see in the picture. Then another important aspect is this K complexes. These are nothing but the high amplitude sharp outburst of the waves. Okay, and this also occurs irregularly. Sleep spindles and the K complexes are the 2 important remarkable findings of EEG in stage 2. And in stage 3 and 4, that is N3, which forms around 10 to 20% of the total sleep duration, this is predominated by the delta rhythm. You know, delta rhythm is actually high amplitude, low frequency waves. Maximum slowing of the EEG rhythm will happen at this stage with larger amplitude. It is very difficult to wake up the subject from this stage. Okay, and young individuals, young healthy individuals, they spend maximum time of their sleep in this stage only. Now we can see the EEG pattern. This is the awake pattern where you can see the Beta rhythm, it is low amplitude, high frequency waves which occurs highly irregular. This is a desynchronized rhythm. And then comes the N1 stage, where you can see the alpha rhythm. In between there is some occurrence of this theta waves also. Okay, high amplitude, low waves also. This is stage N1. Stage N2 typically comprises of sleep spindle as well as the K complexes. Okay, so sleep spindles, you can see beta like outburst, okay, high frequency outburst which has got typical waxing waning pattern. You can see the amplitude increases then decreases. So this is the waxing waning pattern of amplitude. And this is the K complex, which is a large amplitude sudden irregularly occurring wave pattern. Then comes the N3 stage. This is the delta waves. You can see the large amplitude, low frequency wave pattern. This is the deep sleep pattern. And this is the EEG picture of the REM sleep stage. Once again you can see the REM is almost looking like the beta. So again the REM sleep is also called as desynchronized rhythm pattern. So let us see the physiological changes that happens in that REM sleep. It is also called as restorative or homeostatic sleep because it is in this phase all the homeostatic mechanisms of all the systems of our body happens. There will be decrease in the heart rate, there will be decrease in the blood pressure, at least 10 to 30% decrease will be there. Respiratory rate and the BMR, everything becomes less. There will be fall in the body temperature, the respiration becomes slow, deep and regular. And dreams occur in this stage, but the consolidation of the dreams in the memory will not occur. The patient will not remember anything out of the dreams from the NREM sleep. Okay. Neuronal activity will also be decreased, the muscle tone will also decrease, all the vegetative functions will be decreased. There is no rapid eye movements, that is the most important. That's why it has got the name non-REM sleep. And sleep is quite deep and it is very difficult to wake up the subject from this. Most important point, the growth hormone secretion is maximum in this stage. Okay, that is why the deep sleep and the infants and the newborn, they sleep for a longer duration in which the growth hormone secretion is greater, and that is what is helping them to grow. Coming to the REM sleep, that is rapid eye movement sleep, which constitute about 25% of the total sleep duration. This is the active form of sleep. Actually, the brain is not sleeping in this stage. Okay, it is very active in this stage. Lasts for 10-15 minutes. And this is also called as paradoxical sleep or desynchronized sleep. Why it is called paradoxical sleep? Because the person is sleeping, but when you look at the EEG pattern, it is like a beta rhythm. Okay, so it is desynchronized rhythm and like looking just like beta. Beta, when will you see beta rhythm? When the person is awake and alert. So, though the person is sleeping, his EEG shows different. He shows it as if he is awake. Okay, so that is why it is called as paradoxical sleep. Okay, associated with the rapid roving eyeball movements. This is what is a classical feature of REM sleep. You can see the rapid roving eyeball movements. When you get a chance to observe the sleep of your maybe if there are any kids at home, you can sit and watch the REM sleep, the eyeball movements of the infants and children. Okay. The threshold for the arousal for the sensory stimuli is elevated in this stage. It is also very difficult to wake up the person from the sleep. But when spontaneously awakened, he will be completely clear. Okay, usually that happens in the morning. The neuronal activity during this stage has increased in 3 areas. One is the pons, the other one is the lateral geniculate nucleus, the third one is the occipital cortex. That is why the intense burst which generate this high voltage spike potentials in this region, it is called as PGO spikes, that is pontogenicular occipital spikes. Okay, so that is said to be the initiator of this REM sleep actually. Brain temperature and metabolism, BMR, everything rises and it is seen as if the patient is in awakened state. Okay, the muscle tone is completely lost, complete lockdown of all the muscles except for the eyeball movement muscles, middle ear ossicles and the diaphragm. Except these 3 muscles, all the other muscles are completely knocked off. This is one of the safety feature I should say, because this is the stage where there is vivid dreaming and the person should not act out the dreams. That is one of the pathology. The person should not act out all the dreams that happens in the REM sleep. That's why the tone of the muscle is lost here. Okay, and this muscle inhibition is also because of the inhibition of the motor neurons located at the locus coeruleus of the brainstem region, and all other important features like heart rate, blood pressure, respiratory rate, everything becomes increased and highly irregular. Active dreaming occurs in this stage. Penile erection can happen in men, and women also show some clitoral engorgement. Pupils become constricted. Respiration will become unresponsive to carbon dioxide. Response to heat and cold will be absent. The body temperature will be just like the external temperature, ambient temperature. Reflexes are also inhibited. So, let us summarize the key differences between the REM and the NREM sleep. Timing, NREM sleep occurs first, REM sleep follows NREM sleeps. NREM may constitute 75% of the total duration, whereas REM sleep constitutes only 25%. Autonomic system activation, actually NREM inhibits the sympathetic system, whereas REM sympathetic stimulation is seen. That's the reason behind all the increase in the heart rate, blood pressure, sweating, all those things. Eyeball movements are not seen in NREM, whereas rapid drawing eyeball movements is seen. That is what is giving the name for the stage. Muscle tone is inhibited in NREM, but profoundly inhibited, profoundly depressed in REM sleep. Dreams occur in NREM, night terrors occur, but they are all poorly recalled, and when wakened from the NREM stage, the person will be confused and disoriented. Whether they know something happened, they can realize something happened in the sleep, but they don't know what it is. Whereas in REM, the dreams are better recalled, nightmares will occur. Thank God nightmares are not acted out, and they become fully awake and fully conscious, and they were clear about what happened in the dreams. This is the deep sleep and this is the lightened sleep. EEG waves usually theta and delta predominates. Here EEG of high frequency, low voltage, desynchronized rhythm. The mechanism for NREM is inhibition of the reticular activating system, whereas for REM it is the outburst from the pontoreticular formation, that is PGO's region. Let us move on to the next segment. Theories of sleep must be already covered, but still it's worth repeating. There are various theories, but I would like to highlight 3 or 4 important theories. Number 1, inactivity theory of sleep. This is for evolutionary aspect and for existence. Usually the animals and even the human beings, while being inactive at night, we are all protected from the predators, right? Okay, so this is very important as with respect to the evolutionary aspect as well as for the reproductive benefit of the species. The next theory is energy conservation theory. Okay, so during sleep our muscles are not active, our vegetative functions are not active, so we conserve energy. Okay, so daytime we spend more energy, night time we don't need to have go for food, or we know we are less efficient, animals are less efficient to hunt for food at night. So that part of energy is being conserved. In fact, it has said that the body decreased metabolism by 10% during sleep. The next theory is restorative theory. According to this theory, sleep is the phase where the body functions are repaired and repleted with all the cellular components that is necessary for the essential body functions. Say for example, muscle repair occurs during sleep. Protein synthesis occurs during sleep. That is very important for the enzymatic functions of cellular metabolism. Tissue growth occurs during sleep. Release of hormones, especially the growth hormone, melatonin, all these hormones are important hormones. They show circadian rhythm also. So that happens during sleep. So this is a form of restoration to the body function. And one other theory is the brain plasticity theory. This states that sleep is necessary for the neural reorganization and growth of the brain structure and function. Clearly evident in babies, okay, in infants. So infants, they spend more time so that their neural circuits, they develop better, and the brain development is very active for those babies who have spent their time in good sleep. Okay, that's why they sleep for 14 to 18 hours. Going to the last segment of this session on the sleep health and sleep deprivation. We all know sleep is very important for the normal physiological function, and this includes the strength of physical and mental well-being. The ability to think and concentrate is enhanced. For learning and memory, consolidation of what happened during learning process, all these happens in the sleep. That's why they used to advise after learning, you have a nap or have a good sleep so that your whatever learned is consolidated and taken into memory. Promotes growth, maintains metabolic and caloric balance, maintains thermal equilibrium, immune system becomes better when after a good sleep, maintains natural balances among the neuronal centers for a better brain's work. So these are all the functions. All these functions are very important. Both the quantity and the quality of the sleep is very, very essential. Okay, so there are two important homeostatic mechanisms that can maintain or regulate the sleep process. You know, circadian rhythm is for about 24 hours. In the 24 hours, 8 hours for sleep and 16 hours for wakefulness. That we know. There are two important processes that goes on during our day-to-day life. Process S is called a sleep homeostasis, which is mediated by the chemical adenosine. Process C is the circadian homeostasis, which is mediated by the hormone melatonin. Okay, so let us see, when we get up from the morning 7 a.m. say for example, and all day long we work. Okay, so what happens? Metabolism continues, we are active, we are continuously active. Slowly the pressure for falling asleep, that is the sleep pressure. Okay, so that sleep drive increases as the day goes on and on and on, and it reaches the peak just before the night. Okay, and that is exactly the time where the circadian rhythm also starts. Okay, so during the night what happened? The person, when given a conducive environment for sleep, he goes for sleep. That is from 23 to the next day morning, he goes for sleep. That time what happens? The sleep restores all the lost energy, and the pressure to sleep decreases to the greater. The energy depletion is getting replenished. Okay, and the person no longer feels the drive to sleep, he wakes up. Okay, so this two cycles, that is the sleep homeostasis by the adenosine and the circadian homeostasis by the melatonin. These two pendulums, the homeostatic and the circadian pendulums, if they are in good sync, then the quality of the sleep will be good. If there is some disruption between these two pendulums, then the quality as well as the quantity will be affected, and the performance during the wake state will also be affected. This is what is happening in the jet lag or the shift workers or those who are deprived of sleep for a longer time. That is ending in the sleep deprivation. Okay, so what are the factors that actually disrupt sleep health? Psychological factors include stress, anxiety, depression, increase in the sympathetic tone and cortisol. Medical diseases like sleep apnea, restless leg syndrome, all these we will be seeing about in detail in the further weeks. Pharmacological conditions like usage of stimulants, corticosteroids which affect the circadian rhythm, beta blockers. Okay, these are all the drugs that impair the sleep onset. Environmental factors like change in the shift pattern, change in the meridians, jet lag, all those things, noise exposure, light exposure, all these are environmental factors. Behavioral factors, very, very important these days, excessive screen time just before the bedtime, that is very, very important. Poor sleep hygiene and caffeine, alcohol, all these are actually the disruptors of the good sleep health. So what will be the effect of the sleep deprivation? Cognitive effect is the most marked thing. There will be impaired attention, slower reaction time, decision making will be affected, your judgment will be affected, your work ability will be affected. Cardiovascular effects, BP will increase, there is a risk of arrhythmias and other features will be seen. Metabolic, the person tends to become diabetic because of the insulin resistance growing because of sleep deprivation, obesity risk, and abnormal appetite hormones like ghrelin. All these are actually the end results of sleep deprivation. Immune system gets affected by decreased cytokine production, increased susceptibility to infection. Psychiatric manifestations like depression, anxiety, and burnouts, irritability, all these can happen when there is sleep deprivation for a prolonged period. So, how to have better sleep health? There are certain strategies that we can follow and we can advise our patients to follow, we can advise our students to follow also. Maintain constant sleep-wake schedule. That is very, very important. Daily you are sleeping by between say 10 to 6 or 9 to 6. Sundays alone you sleep for more than 10 hours. Say you wake up only at 9 a.m. on Sundays. That should not be done. You should have a fixed sleep time. Okay, and you follow that routine. A healthy routine is always important. Limit caffeine and screen exposure before bedtime. At least 2 to 3 hours before bedtime you should limit all these things. Create sleep friendly environment. Let the environment be dark. If it is not possible, at least use the eye mask or shields. Okay, let the environment be quiet. Make it cool. Okay, make good air flow should be there, should be ventilated. All these are sleep friendly environment. Encourage the institutional changes for resident work hours. This is definitely to be done because even nowadays that shift, healthcare workers shift duration is reduced. It's not more than 24 hours, and this is the institutional policy that every institution should consider. Educate the patients about sleep hygiene. This is very, very important. It is just like how you advise for the diet and physical activity. You should advise about the sleep hygiene, importance of sleep also. Sleep is a medicine. Sleep is the best medicine indeed. Okay. So treat sleep as a vital sign, like how we treat blood pressure, pulse rate, temperature. Like that, sleep is also a vital sign now. It is predictable, it is measurable, and it is definitely modifiable. If we modify the sleep, definitely the sleep disruptors will get modified and we could have a very good and healthy life. To sum up, we in this session saw about the stages of sleep. We saw about the two different scoring systems, ASM manual and RNK manual. This is what we are following till now. Stage W, N1, N2, N3 and stage R. Okay, and we saw about the hypnogram and how to read the hypnogram and what is the importance of this deep sleep and REM sleep, what is sleep latency, what are the different cycles of sleep, how much is the duration, how to read the hypnogram. We saw that. We saw the key changes in the NREM and the REM sleep in the EEG parameters. We saw how the awake state beta rhythm changed to alpha rhythm in the N1 interspersed with the theta waves in between. Then how it progressed to N2 with the sleep spindle and the K complexes, and in the N3 deep sleep we saw about the occurrence of the delta waves, and we also saw how the REM sleep is again looking like exactly the beta rhythm and producing the pattern of paradoxical sleep. And we little bit saw about the theories of the sleep as inactivation theory, energy conservation theory, restorative theory and brain plasticity theory. We also saw about the sleep-wake cycle and how the sleep is being regulated by two different pendulums of sleep, homeostasis and circadian homeostasis, and how these two homeostasis has to be integrated in a very methodical and regular way so that the disruptors will not affect the sleep quality and health. And we also saw about what is sleep health and how important it is, and what are the disruptors and what will be the effects if the sleep is disturbed. And we finally saw about few points about how to promote good sleep health. So I thank you all for your patient listening. I thank our institution, Chettinad Academy of Research and Education, for constantly motivating us for all this academic achievements. And I also thank NPTEL Swayam portal for continuously believing in us and giving us an opportunity to spread the knowledge across. Thank you.